Hi, everyone, and thank you for joining us today. I'm Sean Townsley, Marketing Director here at the Morel Company. It's been a pleasure supporting today's session, and I'm excited to welcome you to this important conversation. We're so glad you could join for today's interactive webinar created for nurse leaders. Today's session is titled Reimagining Care, Workforce Innovation Generates Real ROI. We're excited to feature Orlando Health and explore how bold workforce redesign efforts supported by technology like the Hercules Patient Repositioner are delivering measurable results for caregivers, patients, and health systems. It's going to be a practical, forward-looking conversation with insights you can take back to your own organization. We'll get started in just a moment with a brief introduction of the Hercules technology, and then hear directly from today's featured speaker, Dr. Darius Love. Just a quick housekeeping note, all participants are currently on mute, but we absolutely want to hear from you. If you have a question at any point, just drop it into the chat, and one of our Hercules team members will be monitoring so that we can read your question out loud so that everyone can hear and Darius can respond. We'll also have time set aside for a Q&A at the end, so feel free to add your questions at any time today. Here's a quick look at where we're headed today. We'll start with a brief overview of the Hercules Patient Repositioner technology. From there, Dr. Love will walk us through Orlando Health's system-wide efforts in workforce redesign, including how they're improving safety, efficiency, and care quality through innovation and collaboration. Finally, we'll wrap up with the Q&A to answer any questions that you may have. So before we dive in, we'd like to take just a couple of minutes to introduce the technology at the heart of today's session. As the sponsor of today's webinar, we appreciate the opportunity to support these conversations and share tools that are making a difference for caregivers and patients alike. Here's a short video that introduces the Hercules Patient Repositioner.
Hey, do you have a few minutes to give me a hand? Yeah, I'll be right here. Sorry.
Boosting patients up in bed like this is about to be a thing of the past. Let's go see how. It started with wanting to completely eliminate boosting injuries occurring with bedside nurses.
I lift patients about 10 times during a normal shift. Each time it takes 5 to 10 minutes, and I have to go find somebody to help me. So no, not exactly what I went to school for.
So we began to think creatively. Starting with the inspiration from an automated pool cover, we thought, what if the sheet itself could boost the patient? With each new concept, we would solicit feedback from nurses in the field who either quit the profession or are on their way out because of the toll it was taking on their bodies. It needed to be small but powerful. Every patient is unique, so the device had to cover a wide range of situations while keeping the patient safe and comfortable. It needed to be universal because there are so many different types of beds on the market. Our device had to be a perfect fit for all bed models. And lastly, it needed to be extremely reliable, easy to clean and maintain, so we designed it with precision engineering discipline. And what we ended up with is a product that will change the nursing industry forever. It's called the Hercules Patient Repositioner.
Hey, how are you?
Oh, pretty good.
That would make me comfortable.
Thank you. I appreciate that.
How's that?
Oh, that's much better. Thank you.
By simply pressing a button, you can do what normally takes 5 to 10 minutes in less than 10 seconds without any physical effort. The Hercules Patient Repositioner only has 3 components that work together to do this. The drive unit, which is the brains and muscles of the system, the simple replacement of the mattress cover to keep the sheet aligned, and a special sheet that is twice as long as the normal sheet, which allows for 10 to 12 patient repositionings.
The results speak for themselves. After implementing Hercules in hundreds of hospitals, every facility has experienced 100% elimination of boosting injuries, a significant reduction in caregiver turnover, over a 50% reduction in infection exposure because less people are required in the patient's room, and a decrease in hospital-acquired pressure injuries. And yeah, we're pretty proud of those results. Typical bedside nurses spend over an hour of their shift boosting patients, but now that can be done in a total of 2 minutes. Less time boosting means better patient care, quicker response times, and healthier nurses with improved morale.
So now we're doing something about nursing burnout. Our goal always with this product was to make life safer and easier for nurses and patients. And Hercules is accomplishing that.
Now, I'm excited to introduce today's speaker, Dr. Darius Love. He serves as the Assistant Vice President of Workforce Optimization and Redesign at Orlando Health, where he's helped to lead bold system-wide changes that support caregivers and improve care delivery. Darius is a proud native of Muscle Shoals, Alabama, and brings deep nursing leadership and operational expertise to the table. Before joining Orlando Health, he served as Service Line Director for Neuroscience and Oncology at Baptist Medical Center in Jacksonville, where he led several care model innovation projects. He holds degrees from the University of North Alabama, the University of St. Francis, and the University of New Hampshire. And he's an active member of the American Organization for Nursing Leadership. Darius brings a wealth of expertise in nursing leadership, innovation, and operations. From his early days as a neuroscience nurse to his work driving excellence across hospitals in Alabama and Florida. We're honored to have him with us today. Please join me in welcoming Dr. Darius Love. Darius, we're so glad to have you with us today. The floor is yours.
Thanks so much. So good afternoon, good morning. Greetings to you in whatever time zone that you are representing. I am super excited about this moment in time. So over the past few years, I've leaned into a phrase that I believe is applicable to the time that we'll spend together, and it is moments matter. And so this is a moment. Anytime that we are able to gather together as colleagues, glean knowledge, get understanding, toggle back and forth ideas is a moment. So thank you for being here, and thank you for leaning into this moment. And I'm thankful to the Morel company for providing us moments and time to share. So with that being said, I hope that in our time together, something is said that is impactful, something is said that adds fuel to your journey and or sheds light along the way. So let's dive in. So a little bit about Orlando Health. We have experienced exponential expansion. So now we are 58 hospitals and EDs, about 5,500 inpatient beds, almost 40,000 team members, the only level 1 trauma facilities in a couple of the regions and the counties in which we are called to serve. And likewise, our footprint takes us coast to coast in Florida, into Puerto Rico, and into Alabama. Our high quality outcomes from an awards and recognition standpoint have been recognized and included through organizations like the ANCC, US News, and in Leapfrog. Next. So, just to give light on what my role is at the organization and how we lean into the work of reimagining. So, in 2023, the American Association of Critical Care Nurses, along with ANA, released some key recommendations on how organizations should be approaching the work, i.e., the work that we are so called to as clinicians. In a post-pandemic world, how should we be leaning into work post-pandemically? And as we endeavor to talk about our Hercules journey, it is my opinion that this body of work falls into a few of the buckets that are on your screen. The buckets that they fall into, I would say, are establishing workflows that consider human factors, reduce workarounds, and minimize cognitive workload. I believe that it falls into research, pilot, and measure the effectiveness of new models, address scalability and impact on nurse and patient outcomes. Likewise, I believe it falls into improvement strategies to support de-implementation of high burden, low value patient care service tasks. This is how, in a nutshell, of how I have leaned into the called work of reimagining care, not only post-pandemically, but for the world that we live in now. Next slide. I would like to say, and take a moment to brag on our organization. So, the ANA and the American Association of Critical Care Nurses released that body of work in 2023, around 2023. But the way that we have approached reimagining work for our enterprise standpoint kind of started back in 2022. So, I'd like to say that we are leading the way in this approach. And I say that because our system chief nursing officer wanted to ensure intentional strategy in our pipelining approach with our academic partnerships, our development of effective leaders, optimization of resources, our strategy around redesigning the work, and creating intentional strategy when it comes to standardizing and scaling best practices across the enterprise. And so a large portion of the work that I'm called to is reimagining and redesigning the work. So optimizing resources and redesigning or reimagining the way that we do the work that we are called to do. So creating structure and strategy to aid us in navigating the challenges in healthcare, ensuring that we create runway for us to rise above and to meet the needs of the people and the communities that we are called to serve now and in the future. We can go to the next slide. So we have foundational understanding of what challenges are that we're facing in healthcare, and I don't believe that these are specific to nursing. They are encompassing of the conglomerate. We understand that retention is an issue, workforce challenges. There are several generations in the workforce, and we just had a leader development session where we found out that throughout our enterprise there are some Gen Zs that have broken into to leadership. So now we have several generations in the workforce providing care to patients, and several generations in leadership leading the way. We have new expectations with technology and the way things are going in market, and globally in healthcare. We have new expectations from team members and patients alike. We have understanding that we have a novice workforce. Recruitment in some spaces remains is a challenge, and our continued need to meet our call and ensuring that we have surrounded our call with care and with intentionality and precision so that we can continue to meet the needs of the communities in which we are called to serve. Next slide. So let's journey into our story, our OH Orlando Health story as it pertains to Hercules. So, with any new body of work, with any new implementation, my team and myself spend time asking the question. We spend time in pre-work asking the question, foundationally asking, what specifically are we trying to solve for? How do people, process, and technology lean into what we're trying to solve? Foundationally, we have understanding that we cannot boil the ocean, and there is not one solution that solves all of our problems. But what can we do, and how can we lean in to address those things that continue to rise to the top and resonate at each level. They need to resonate from the front line all the way to our senior executive leadership team. And this is where we begin to construct our story and lean into the art of storytelling to connect the stakeholders and the audiences that live in those various levels, all the way from frontline team member again to our senior executive team. The power of storytelling has allowed us to engage from the very beginning and create a journey for all of us prospectively in our various roles. So, what became important to us in our initial review of Hercules? So, foundationally, it was our team members. On top of that, or layered on top of that, it was reimagining how we move and position patients in bed, and giving back time to our clinicians to create high quality touch points. So equally important to those things, equally important to our team members, equally important to giving back the gift of time is the perception of care. How are our patients perceiving our approach to care delivery as an organization? So next slide. Picture it, Sicily, 1864. But no, really picture it. Picture reviewing the data once we decided to lean into the journey and when we decided to create our story. From fiscal year, our look back as it pertains to our data started in fiscal year 21 and took us into fiscal year 23. There were millions of dollars in team member injury, thousands upon thousands of restricted work days. So thousands of worked shifts where somebody that we needed to be at the bedside could not be there because of an injury. And what we found out as we did the deep dive was 68% of those injuries were attributed to bedside clinicians, nursing and allied health alike. So in that foundational data review, in those moments in time of pre-working, we created avenues and spaces of knowing that we needed to intervene. So fast forward from that, we were able to get a pilot up and running at our flagship hospital and at one of our community hospitals. And so, as we looked at those implementations, or those pilot implementations, they were 90 days, and we had the opportunity to um, poll or receive feedback from over pre and post survey. Those totals are about 300 plus team members gave us feedback. So throughout our time together, you'll hear me say often that feedback is a gift. And what we received was foundationally from the pilot was foundationally important. Our team members said at large that they believe that Hercules could has the potential to increase their job satisfaction. It makes them feel safer performing tasks associated to this called work of being a clinician, and it has the potential to reduce burnout or fatigue concerning the work that we're called to do. Next slide. So everything is done with intentionality. Our team members are our crown jewels and they serve as our strategic advantage. So it is increasingly important that we create avenues and spaces where they want to stay and grow. We at Orlando Health pride ourselves on being a best place to work, and we have foundational understanding of our landscape. We happen to live in the happiest place on earth, the home of Walt Disney. So recruitment is not necessarily where we have the opportunity. However, by living in the happiest place on earth, we understand that retaining of top talent is an issue, and it was an issue for us in our legacy market when it when it came to the retention of our team members. As we continued to dig into the opportunities that surrounded turnover and retention of our team members, an area of focus rose to the top, and it was our PCU level of care. PCU rose to the top as an area of opportunity that was outpacing the organization from from a turnover standpoint. As clinicians and as clinical leaders, we have understanding of the PCU landscape. We understand that PCU is a hybrid, sometimes a hybrid level of care. We have lower acuity patients mixed with higher acuity patients that turns into our team members being pulled in various and sundries of direction as they navigate really complex care in an area. So as leaders, we spent time understanding pain points related to our PCU level of care, spent time in the Gemba understanding of workflows that lived in that space, and coming up with plans together with our PCU team surrounding what is a targeted tactical approach that will yield us the results that we desire to see in this space. And so a team of us came together and created, if you will, a PCU care package. Again, feedback is a gift. This feedback came from the people that were doing the work and the leaders that are leading the work in those spaces. And we heard them loud and clear. And again, as we stated earlier, there is no silver bullet, but how do we surround our strategy with intentionality in such a way that it drives impact? And so, in receiving feedback, we have understanding that career pathing is an opportunity in our PCU space. Our team members want to know what is next and what is on the horizon as they endeavor to navigate through their healthcare journey. Level of care alignment. We want to make sure that PCU across the enterprise are experiencing the same things, that patients of similar diagnoses live in this space and they are right patient, right time, receiving the right care. Hercules again came into play. How do we make work easy and efficient without compromising quality? Is the vein that we would lean into there. Innovation prioritization, our PCUs are our first stop when it comes to innovation. Again, easy, efficient, without compromising high quality care. Education and leader development were also how we prioritize and surrounded our PCU or all inclusive of in our PCU package. Next slide. Fast forward to October 2024. We began our Hercules PCU implementation. We grew exponentially during our implementation. So the data you see here, and as we talk about Hercules, is specific to our legacy market. So Hercules became a part of care delivery at 7 of our hospitals across all PCU in our legacy market. And the outcomes have been impactful and they have been tangible. And one way that we received a response was through decrease in turnover and retention. Our team members, our team members' response to our PCU care package was heard loud and clear and really resonated throughout the organization, because through this intentional strategic work, we saw a decrease in PCU turnover, and the organization at large beat our goal by our turnover goal by a few percentage points. So on the slide, again, Hercules implementation took us from October 2024 into December 2024. Since we have gone live in PCU, we have not had any team member injuries related to safe patient handling, moving patients in and out of bed. Zero restricted work days in PCU related to safe patient handling, and zero lost work days related to injury. Our team member satisfaction was increased, and we'll see on another slide what our team members said. But Hercules did impact our team member satisfaction. Team member injury in this space has been a huge win for our organization and continues to underscore the need for the need for investment and the need and really highlights Hercules' impact on team members and team member injury. What we did see also in the data, what are our patients saying? And we know that the time that it takes to find peers and team members to help move to lift or boost patients in bed, really once you start to add it up, is astronomical. And what our team members told us foundationally in the pilot, that they were spending upwards to almost 2 hours in of their shift boosting with the boosting patients, and that's all encompassing of the mechanics, finding the people, positioning the patient in bed to ready them to move, positioning the room to allow for safe boosting in bed. And then once you are able to boost your patient, undoing what you did to create that moment in time for boosting. So as we live in data post implementation, something that we did see and highlight in our patient experience was this created, we saw and were able to associate it to the time of implementation, that our patients said that they received help as soon as they needed. We saw increase in that domain during our Hercules implementation from that standpoint. Let's go to the next slide. So something that we ask ourselves as we look for new bodies of work and as we endeavor to reevaluate and evaluate our implementations and the work that we pilot is we have this foundational saying: if it doesn't resonate with the team, should we really be doing it? And this body of work has resonated with the team. This is feedback directly from our team members. Hercules saves time. The use is simple. It gives give every unit a Hercules bed. It overwhelmingly, our team members say in our PCU space, says that Hercules has impacted their daily workflow. It's improved their job satisfaction. It's reduced fatigue related to safe patient lifting and repositioning, and it contributes to our commitment to being a best place to work. Next slide. What we learned, we are content. Oh, before we get to what we learned, we'll share feedback directly from our team at our South Region hospital, at our South in our South Region, from a few hospitals there.
Hello, Orlando Herald. My name is Ailey, and I work for PCU. And I'm happy that we have the Hercules bed because we work faster. We don't break our back anymore. We don't break our knee anymore, and we're in love with it. Thank you so much.
To be honest, it's the best thing ever that we receive over here.
I agree. It's such a savior for boosting patients. So you can do it on your own. You don't have to worry about hunting somebody down and spending time doing that. It's great.
Save our backs.
Yes, definitely.
So the Hercules bed honestly brings a wow factor now to Dr. Phillips. Patients are surprised at the ability that it's capable of just moving them in the bed on the touch of 2 buttons. Easier for them and easier for us.
Okay, I love Hercules bed. I think Hercules beds are amazing because we don't have to put so much strength in our backs while pulling up the patients, and we do our work way faster and it's more comfortable for them. Thank you.
I like the Hercules beds because we don't hurt our backs and we work faster and it's more comfortable for us and the patients. So thank you, Orlando.
I think Hercules bed is the best for us. He saved our time. We love it, and the patient love it too. We can do our job faster. Thank you all in your help.
So again, you see, it underscores us being a best place to work. It resonates with the team, and we created avenues where we're able to reimagine care together and really redesign our approach to care delivery in the vein of boosting and and lifting patients. So we'll journey forward into lessons learned. So, lessons learned. Teamwork makes the Hercules dream work. We could not have accomplished this body of work without active engagement from our colleagues from the beginning. We didn't journey and then say tag your it, join us. From the very beginning, we created spaces and time where our EBS team, our clinical engineering team, our finance team, our supply chain team, allied health and nursing could come together and really carve out what the path ahead looked like. Um, communication, communication, we have understanding that communication is key. I believe that there is no such thing as over communicating, letting teams and people and leaders know what to expect, when to expect, and how this impacts them is vital and it is essential and it is essential. Likewise, setting strong foundation when it comes to communication only enhances the engagement of the audience as you continue to tell the story of why your Hercules or any implementation is important and impactful. The power of planning. Do not negate the power of a walkthrough. There are so many moving pieces, so many teams involved, and so adequate planning and carving out the path ahead is super important and super and being that level of intentionality is one that I would make sure to lean into. Finished is not final. So post implementation, we live in the data. We live in the data, we live in the feedback, we live in rounding, etc., because the outcomes help us continue to navigate support for continued investment, again, with this project and or any project. And it helps us create a strategic approach to implementation for the future. So with that being said, an example of that is our success in PCU has driven us to a level of care approach to implementation. So we are going and journeying where the data deems impactful for us. So next slide. So tell the story. Be bold, lean into storytelling. What is the data saying? What is the team saying? What is the market saying? And what is our response to that in the form of applicable strategy? So for us, we had understanding that turnover was an opportunity for us. Our team members, again, are our strategic advantage. What we do care about, what our patients perceive as it pertains to their care. And we want to create places where people want to stay and be. From a market standpoint, how does implementation and innovation differentiate you in the market? And for us, we are the first health system in Florida to implement Hercules from an enterprise standpoint. It's a market differentiator for us, and again, a recruitment tool as we have understanding that that we live in a market and in a workforce that has foundational expectations for us as we reimagine care and as technology and healthcare continues to advance at rapid pace. And again, being a best place to work is who we are, and it is it's what we do, and this implementation yields itself to doing just that. And so, with that understanding, with knowing what we need to do, what our plan of attack is, creating the story and communicating it forward to the team is super, super important. Next slide. Nothing is done without being able to be traced back to our strategic imperatives. How does this align with what our guiding principles are? And so from a Hercules standpoint, it allows us to embrace quality and safety. It allows us to be a best place to work. It allows us to drive growth and innovation. It does allow avenues to strengthen our economics. It does serve our customers well. And as we keep clinicians at the bedside, we do gain our physician loyalty. So next slide. Again, I am thankful for this moment in time to be able to spend with you. Uh, Several of my friends and peers are on from Orlando Health, and I cannot say thank you enough to you for journeying and leaning in with us. Candace and Ash are on the line. I could not have done this body of work without your leadership across the enterprise. So super excited for the future. And again, it takes a village to do what we do, and I am so happy to be a part of this amazing village. So happy to spend time with the group at large, answering any questions.
Thanks so much, Darius. Fantastic presentation and so much passion, as well as data being shared with our audience. So much appreciated. At this point, we'd like to hear from those of you in the audience. If you've got a question, please drop that into the chat. Danielle DeWitt from the Morel team will read them out loud so everyone can hear, and then Darius can respond live.
Darius, I have a few in the chat, so I'm going to read one off to you. It's a few-part question here. It says, was pressure injury rate tracked during this time? If so, was a pressure injury reduction seen? Are any other devices, tools used for turning patients along with Hercules? And is Hercules an actual mattress, or does it go on an existing mattress? The first part was about pressure injury reduction tracking.
So, so pressure injury rate was tracked and is continued to being tracked in our organization. And again, we have encompassed this body of work with a lot of intentionality. So we use the Hercules beds across PCU. We also use Rover and the ED2 to track pressure injuries upon admission. And so to that point, we have seen reduction in pressure injuries in this space. And so I would say from a pressure injury standpoint, both of these tools have been really impactful to us in seeing reduction in our observed versus expected outcomes, and I'm going to knock on wood, and in our facilities where we have gone live with in these bodies of work, we are outperforming the goal, and so we're top decile, top quartile in a lot of those areas. Is Hercules an actual mattress, or does it go on an existing mattress? I am probably someone from Morel probably could chime in and answer better than me, so I will give you. I it attaches for us. It attaches to our existing mattress. Again, from the earlier video, the Morel company has created spaces and places where it can be mattress agnostic. So based on the needs of the site and or facility, you can decide how to approach it from a mattress standpoint. But it is mattress agnostic. I see another question. Have we been able to quantify turnover reduction and assign a dollar value to it? 100%. We saw a reduction in PCU, and we met our goals. So we were able to take that dollar. We were able to take the decrease in percentage, and we have foundational understanding as healthcare leaders, that turnover is a six-figure cost. And so as we have looked at creating cadence for continued investment, that is a data point and a dollar amount that we do use when we express the need for, it's a data point that we use to help us continue to navigate um, engagement in our Hercules journey, as well as communicate it as a win to the team. So, oh, go. I'm sorry, Danielle.
I can read the next one if you like. We have one that says, was your organization's finance section able to understand and support the conclusions that your pilot project arrived at regarding the benefits of Hercules?
100%. And I will say what was a secret weapon for us was finance journeyed with us from the very beginning. So we knew that this is something that we wanted to investigate. And so before we even piloted, we brought our finance team in with us to say, to foundationally say, hey, our call is to reimagine care. And on this front, this is a mechanism that allows us to do it. Journey with us. And so, as we looked at pre-data, as we looked at potential impact from implementation, as we looked at pilot feedback and carving out what the potential path ahead looked like, our finance team was with us from the very beginning. And so, it again just allows us another layer when it comes to leaning into what our story is. And so from the very beginning, we were able to partner with finance, and through implementation, pilot and implementation, we continue to partner and communicate the outcomes and results.
Thank you. Another question kind of similar. It says, what headwinds, if any, did you face with administration in bringing this to your health system?
Um, what are any headwinds? Everybody, I mean, foundationally, I believe that the people that are responsible for leading the organization want foundational understanding as to why the investment, what does it look like? Again, what are you solving? What are we solving for? And what are the potential gains from an implementation such as this? And so very early on, being able to articulate, carve out, create understanding of what our current state is, and how reimagining this body of work can impact what our current state is, and give us a strategic advantage and keep our team members at the bedside and underscore us being a best place to work, really just helped us navigate those conversations and created spaces and time again where not only have we procured feed engagement at the bedside level. Now our senior executives are engaged and curious about what the impact is, and are willing to lean in with us.
It looks like the two next questions are pertain to patient satisfaction. One person is asking, are patient experience scores and commentary reflecting the deployment of Hercules?
Uh, I I would say yes, and not just because I'm leading the body of work, but there's there's notable increases in domains that would that we can tie back to Hercules during the implementation period, from that standpoint. And our patients continue to give us feedback from an innovation standpoint. So there is merit there in the data that does suggest that. For us, um, for us, when we started to lean into outcomes, what rose to the top for us and really kind of became the heart of our message was the ability in a small window of time. We haven't been live at in PCU over a year yet, but the ability to up to this point in time to eradicate injuries in that space related to safe patient handling has really been where we the heart of our story and our outcomes.
Um, I have another question. It's asking, have you marketed this investment um, in your clinicians as a differential, like your market for retention and recruiting? Is that something you see as valuable in partnering with nursing schools and the next wave of nursing who to want to work at Orlando Health?
100%. So, again, when we talk about um, engaging everyone in the journey, our talent acquisition partners, once we got the all clear and had strategy from where we were going to implement, they were some of the first people I called and said, "Hey, as you recruit in the PCU space, this is what you're able to tell them as it pertains to not only our Hercules, but our PCU care package, really." So there was intentionally internally, as it pertains to it, Hercules being a differentiator for us and a strategic tool for recruitment to Orlando Health.
And I think I just at this point have one more question. Has there been any pushback with your nurses regarding Hercules?
There's not been any pushback. Again, everybody wants to know why, how, what to expect, when can I expect it. So there were a lot of questions initially about the implementation. There are a lot of questions concerning when can we get it and when can we get it next. But from a pushback standpoint, um, as as this not being the way the organization should be leaning in, we did not. And I think again, leaning into our shared governance model, leaning into including everyone in the journey up front, I believe really aided in the fact that we created foundational alignment up front, so people knew what was coming, and they were willing to lean into the journey.
Might have one more that popped up in here. Um, have any physicians used the device and are they comfortable with Hercules in general?
So during implementation, there were some physicians that did come around and were able to see it, and everybody's been comfortable. Again, our Allied Health and PT partners, when we did demos, absolutely loved it again because they were a part of the 68% that were a part of our foundational data when it came to injuries related to safe patient handling. So they were everybody from a cross-functional standpoint has either touched, seen, and or heard about Hercules and has given us really positive feedback about it.
And if you don't mind taking one more, I have another one for you, kind of about financing. It says, you mentioned your finance team also began the journey from day one, which provided more understanding and buy-in to the project along the way. For facilities where finance teams are not brought into the discussion until later in the process, do you have any recommendations for nurse leaders on how to gain the necessary support for this type of initiative along the way?
Yes, so twofold: be bold and disrupt the process. Your finance team has to be engaged day one. Um, However, in the event that that is not standard practice, and we can't be bold and disrupt the practice, I would say that carving out a strong foundational plan that really sets the initiative up for success as you move it along is super important. And so what does that look like? Again, foundationally, what are we solving for? We can't boil the ocean, but these are top priorities that rise up to the top, and they are impactful and important to frontline team members, frontline leaders, and our executive team throughout the hospital and or the organization at large. So this is what we're solving for. This is how we can get there, and this is what we can anticipate by way of potential increase, decrease, and things of that nature. And this is the impact. So really outlining and being really intentional and thoughtful about what that foundational, I don't like to say what that foundational argument is, but what those foundational items of support are as it pertains to moving the body of work forward.
I think that is all the questions we have at the moment.
All right. And thank you, Darius, for all of your answers. We did have a question that came up earlier that you addressed regarding the mattresses, and it was asked around kind of the mattress, and you addressed it that way. Just wanted to also offer that not only are we mattress agnostic, we're bed agnostic, and so Hercules is designed to work with your hospital bed and can work with your existing mattress if that's the technology that you prefer. We also have mattress options that work with the system. So great questions, everybody. Before we wrap up, I just wanted to take a moment to thank Dr. Darius Love for sharing his time and expertise today. Darius, we are truly grateful for your time and perspective. Hearing how you and your team at Orlando Health are approaching these challenges has made this an incredibly meaningful and insightful conversation. And to all of you, thank you for being here and for the work that you do to support your teams and your patients every day. Please check your email later today for a quick follow-up note that includes a recording of this session and a short feedback survey. Your input helps us improve future webinars and continue to bring relevant conversations to the forefront. Thanks again, and we'll see you next time.